in person we say it. So, finishing off Clostridium botulinum. So symptoms are going to take about 12 to 72 hours after you actually ingest the toxin in food or drink that you have. Post-ingestion, then you start developing the symptoms. And on the low end, 12 hours if you have a lot of the toxin versus high end, like 72 hours if you just have a little bit. Early symptoms are kind of non-specific, double vision, difficulty swallowing, dizziness. A lot of things can cause that. Later symptoms are the ones that get ugly then. So descending muscular paralysis, remember it's the flaccid paralysis, so your muscles can't contract. And then eventually respiratory failure, but in this case because you can't contract your lungs. Having respirators around has now reduced the death rate to about 10%, similar to the low end of tetanus also, again because of respirators. And eventually, of course, the toxin does break down, so if you kill off the bacterium and then just help the breathing until the toxin breaks down on its own, then the patient usually recovers. You can have infant botulism, which is the rare situation where the bacteria itself actually gets inside the person and then produces the toxin. So you ingest the spores if you're an infant, they germinate in the body. So where it's also called floppy baby syndrome for anyone that's had a baby and they're naturally kind of soft and floppy anyway, and then they get botulism and they're real floppy because they then can't contract any of their muscles. This is going to happen because infants, as we know from earlier in Unit 3, where they don't have much of a microbiota starting off early age, it's still developing, so there's basically space where pathogenic bacteria can get to. Spores germinate in those areas in the intestine, which is largely anaerobic also. Usually 80 to 100 deaths per year in the US and pretty much random, and a lot of them are these infants, like you're making your own canned baby food of some kind or bottled preservatives and then you give it to the infant. Raw honey also tries to be common for this one, and then homemade baby food, of course. Moving into leprosy. So this is also called Hansen's disease after the poor guy that happened to discover it. Caused by mycobacteria. We remember mycobacteria, they're acid-fast. Like when we did mycobacterium earlier in acid-fast staining, we use mycobacterium, but not a disease causer. This one actually caused that. It's Mycobacterium leprae. And this is the same leprosy if you read parts of the Bible and heard about leper colonies and all that. That's this disease. So it's an acid-fast rod. It grows best at about 30 degrees Celsius, so less than body temperature, but still pretty warm. And that's why it prefers the outer portions of your body. That's why you hear the stories where, the nose fell off, or the tips of the fingers, or the toes, they fall off. Or actually the testicles in guys, yes, that would fall off also first because it is an extremity. So that's why, because it's slightly cooler temperature than the rest of the body. Generation time is very slow, even under ideal conditions. It's about 12 days, so that many hours, 24 hours in a day times 12, to actually go from one cell to 2 cells. So every so often you'll hear about a case where like someone went traveling in Europe or Asia or something, and then a whole year later they start developing symptoms. It's because they've been infected that whole time since they went on their trip, but it just took that long for the bacteria to replicate to that high enough number.
Can you catch it early, like prevent it?
There's not really a vaccine for it because there's not that many cases of it. And there's not a preventative thing because you don't really know you have it until you develop the symptoms. And it's not common enough where, we got to get tested after I come back from my trip. It's only usually when you actually start developing the symptom. And it's endemic in some countries, like in Europe and Asia and all that. So it is possible to have it anytime you travel to those countries, but still it's not that common either. And it does seem to be where you have to have close contact to actually catch it. So it grows in your peripheral nerves and your skin cells. So this one doesn't get to your central nervous system, and you're not likely to die from it because of that. But it survives great in macrophages that tend to try to eat it up, and then it invades the myelin sheath of your peripheral nerve. nerves, the parts of your nerves that naturally conduct signals from one neuron to a muscle or from neuron to neuron. Transmission requires prolonged contact with an infected person or the inhalation of secretion. So that's why leper colonies tend to spread this then, because you have a whole concentration of people, so anyone that even visits the leper colony has a high chance of getting it, because then there's lots of people that have it in close proximity. But crowded conditions seem to increase the likelihood of being infected, or just someone that is infected and then their partner or parent or kid or something that's always in contact with them, then just by chances of exposure constantly, you're likely to pick it up. So 2 forms of the actual disease. You have the tuberculoid or neural form, and then you have the lepromatose or progressive form. And some people go from one to the other, others stay at just the initial form. So with the tuberculoid or neural form, that's the less severe form. You have loss of sensation in various areas of the skin. Patients have a normal cell-mediated immune response in this case, so that they can at least contain the infection, and the only major effect are your loss of sensation. And then you have discolored regions of the skin because some of the skin cells that produce pigment are infected. So these regions may have a border of nodules that actually rise up around there, so you can see the outline of it where the actual discoloration has occurred. If your immune system is weak, or you start on chemo or surgery or something, and that's also another way you'll have patients oh, I took a trip to Europe a year ago, I didn't realize I was infected, and then you schedule a surgery of some kind. Then they put you on anti-inflammatories, and suddenly the leprosy is no longer contained, it starts replicating, and then you start having symptoms. So in this case, disfiguring nodules, and this is the kind that you would hear in the Bible stories. They'll happen all over the body, and mucous membranes also are affected. You have progression from the tuberculoid from initially, but you can't contain it, so it continues on. Nasal membranes are especially affected because it's a cooler temperature. And then you have deformation of the hands, they form a claw, and then you have necrosis of the tissue, on especially the extremities, like the fingers and toes and nose and penis of males. It's about 100 US cases per year, but it's mostly in immigrants that are coming from where it's endemic, and then they just come here and then they start showing the symptoms. So this is something you could totally randomly have someone picks it up from Central America or something, moves to the Central Valley of California. You happen to be the first nurse on the scene that gets to see the patient. And you might be the only one that recognizes it, because doctors don't get trained to recognize leprosy very much.
We had a client in Orosi a few years ago with that, and he was missing. I want to say he was missing his right ear,
Yep.
part of his nose, and his hands were similar to that.
Yep, that's exactly what would happen. And they used to have leper colonies right here in the US, the same thing.
But
Just
he was really older. He was an older man.
What's his name?
That's THI information. And I don't even remember. He was Spanish speaking, so I had to go out with the nurse.
But I assume he actually had traveled to Mexico or something and further.
No, he was from Mexico.
Yeah, so he had gotten it earlier in life, and then just by age even, your immune system weakens.
He was in a wheelchair, because I guess it also affected a lot of his mobile
Yep,
health and stuff.
right.
So it was a very interesting
Yeah, because
case.
so it does happen in this area, and you might happen to be the one involved in getting to see that rare kind of case. It's cool when you get to see a rare disease around here that isn't common, because then it's oh yeah, I recognize that. I remember that one. And there have been a couple students that have said, I was the first one to recognize that it was so and so kind of infection. And then of course the doctor, oh yeah, that's exactly what it is. But it's cool if you're that nurse or or nurse assistant or anybody that's oh yeah, I remember that. So here's those discolored nodules or discolored areas with nodules around the edge that you might see here with the tuberculoid form, and then these claw kind of hands that you would have when it progresses.
So do the tips of your fingers fall off?
Eventually, yes. Like
that
the
just they just
tissue
start to-
goes through necrosis, and actually, it's a lot of it. Like you'll see if you see movies and TV shows where they depict this, like they're all black. Kind of the nerves get infected and they die, so then you don't have the sensation. So then, in a lot of cases, like just by normally bumping your hands or fingers or something, that causes damage. And you don't realize it, and oops, I just broke off a piece of my finger, oh well.
Because it makes it super fragile after
Yes.
it's from dying off.
Right, but you still don't have the sensation to realize that either, so you're not feeling pain as a portion of your nose comes off or a toe breaks off.
Is it painful though when your nerves are actually dying though?
Yes,
Feel the
that,
pain?
you do feel some of that pain, but not as much as if it's just like a cut nerve. So even, yeah, it's a slow progression, so the pain isn't as severe, but it's supposed to be a constant pain as they're dying off until they're completely dead. Then you have no sensation. So that got us through bacterial diseases. Now a few viral diseases, like 12 slides of viral diseases. Starting with poliovirus. So this is the one that causes poliomyelitis. Another one that could be completely eliminated from the world if we actually could get everyone to get vaccinated. And we got close actually, and then we failed miserably right at the end of that. But poliovirus is the one that causes poliomyelitis. This is the one, like, depending on your age, your parents or grandparents remember their school days where like a lot of their classmates would be walking around with crutches because of this. So that was because they got polio as a kid, and then they could no longer use their, especially legs, and then they would need the walking assistant, and they would, be your age, but holy crap, they can't walk. This is also the thing that ended up killing FDR right at the end of World War II. So it's an infection of the spinal cord, and that leads to muscle spasms. It's also called infantile paralysis because it affects infants mostly. It's a naked RNA virus, so if we remember the structure of a virus is basic, so it has an RNA genome and then it has a protein capsid, and that's all it has. It doesn't have a membrane surrounding that, so it's not envelope. That also makes it more likely to survive your stomach acids and enzymes and make it to your intestines, where infection is going to start off. Sporadic cases of this can occur year-round, so it's not limited like a lot of the respiratory viruses and things that become skin infections. Transmission is going to be oral fecal, so food, water, your hands that have touched contaminated, like feces contaminated stuff, objects that are contaminated with the feces themselves, and then mechanical vectors, so like flies and cockroaches that have landed on food or feces that has the virus in it, and then acting as a physical or mechanical vector to spread it to your food. Worldwide vaccination campaigns have reduced cases dramatically, so that as recent as 1988, there were 350,000 cases, and it used to be well into the millions throughout the 50s and 60s. Got down to 140 cases in 2020, which is the most recent time I have decent data for, but it is endemic in parts of Pakistan and Afghanistan. It's not likely we're going to ever get all of them to get vaccinated in that area. There hasn't been a natural infection in the US since 1991, so it's been about 30 years since we've had a natural infection. There have been a few cases where someone's gotten it in another country and then traveled to the US afterwards, but no one's picked it up in the US. They actually just had a few cases also in Africa pop up this past year, so it's still not being wiped out. They were making good progress in the 2000s, and ironically it was actually when they were trying to identify where Osama bin Laden was hiding out, and they did a thing where the CIA actually sent in some people in Pakistan that were actual doctors, but to pose like, oh, I'm going to give you a polio vaccine, and they were actually hired or paid money to go like house to house throughout the villages, trying to say, hey, you get into the village, pretend that you're actually giving a vaccine. All they were doing was giving like a regular salt water. They weren't even giving the polio shot. But then while they're in the house, they're supposed to be the ones saying, these age kids and these family members and someone that and they were told who to look for, and that way can narrow down which house may or may not have him hiding out there. So, and it wasn't the actual doctors that found him, but they did help eliminate the areas that he could have been in. But then the CIA, of course, after they got Bin Laden, then they announced that, oh yeah, we hired some of these doctors and they did this for us and all that. Yeah, that didn't sit well with the normal people of Afghanistan and Pakistan, saying, oh, these people are just throwing around fake vaccines and they were just actually trying to invade our privacy and there was no intent of protecting us from disease. And,
Well, you can't give away all our secrets either
well, yeah.
of how we do stuff.
Yeah, they shouldn't announce those kind of things, but yeah, sometimes people aren't the best on that. They might have figured it out eventually also, but yeah, that sure doesn't help making a public announcement. Of course, they weren't purposely trying to out them, but they were like trying to actually thank them. Oh, we couldn't have done this without the help of some doctors we hired that went there. And oops, that didn't help. So yeah, pretty much cut the people willing to get vaccinated in that country dramatically, and in neighboring Afghanistan and all that area actually. So on infection and pathology then, after ingestion, the virus is going to bind to receptors on the mucosal cells. Two areas in the oropharynx, once you ingest it, so back of the throat, and then of the intestines, if it makes it through your stomach and down to your intestine. It's a naked capsid virus, so it's surviving the stomach because it doesn't have an envelope that can be broken down, so it gets past all your enzymes and acids, and then it's going to multiply in both regions, the oropharynx and in your small intestine. Once there's going to be viral shedding into the nearest region, so some into the throat as it replicates there, and then some into the feces as it's replicating in the intestines and going into the feces that's being made. From there, it can also spread into the bloodstream if it goes through the intestinal layer and into the blood. And that's how it can spread into the central nervous system. So early symptoms are going to be non-specific: fever, headache, nausea, sore throat, muscle aches, all the things that are common to a lot of infections. But then if it spreads to the central nervous system via the blood, that's when you have viremia. So viruses in the blood that gets through the blood-brain barrier into the CNS. So virus itself is neurotropic. That means it has a propensity to love to hang out in neurons. So if we have our infected person in this case, they ingest some water that has some of the virus in it. So it gets to the back of the throat, and from there, if you have the ability, you get infected. This is often, even if you're immunocompetent, this can happen, but then it can cross from there, it's replicating there, makes it through the meninges and then into the central nervous system. Or just what you swallow, it survives the stomach, makes it to the small intestines, and then goes from there through the lymphatics and then into the central nervous system here. So you get two forms of the disease then, non-paralytic and paralytic. With the non-paralytic form, you have invasion of your nervous system tissue itself, so the brain and the spinal cord, but it doesn't destroy it. In that case, it's just having a viral infection that causes the symptoms, even though the cells aren't actually being killed. So symptoms are going to be muscle pain, spasms, meningeal inflammation, because it did cross the meninges, and then this vague hypersensitivity to all forms of sensation, light, smell, touch, all of those things. Worst form is to get paralytic disease. This is going to be caused where you have invasion of your motor neurons, and it's actually going to kill some of those cells in this case. So the actual neurons that control your muscle contractions. Symptoms in this case are flaccid paralysis, because those neurons are dying. That's going to affect your legs, your abdomen, your back, your diaphragm, and your bladder, anywhere that needs constant contraction. And then if parts of the brain are infected, your heart and lung muscles are also affected, because your brain has the autonomic nervous system, the natural part of your nervous system that does things on its own. So you don't have to tell your heart, hey, keep beating, or tell your lungs to keep breathing. They do it automatically. But those muscles that are the neurons that stimulate that still need to send signals to the muscles, and they don't get to because they're getting killed off. So if you ever get to hear or see videos or pictures of the iron lung. The last person that was stuck in one of these just died like last year, the year before that. But there isn't a treatment for polio once you get it. There's a vaccine that prevents it really well, but if you get polio, there's no treatment for it. So if you end up getting the paralytic disease, the only way to keep you alive was to put you in one of these giant metal coffins, basically, and you're laying in there most of the day, and it did the pumping, like forcing your muscles to contract. And once you were in those, you couldn't get out of them. And so, yeah, people lived in those for decades, unfortunately. It's a rough way to survive. This was before the days of like heart lung machines and all of that. So with the paralytic disease, because you don't have the neurons stimulating your muscles to contract, you had muscle atrophy. And this was a common sight in like the 50s and 60s in the US schools. You would see a lot of things like this. A lot of kids with crutches because they can't move their feet on their own or legs on their own. So slowly, if you don't use your muscles, they start to atrophy. And like what a lot of you are probably experiencing thanks to this class, you're not getting to do your normal workout. You won't get to work out till the end of this semester. Too bad. But in that case, your muscles are shrinking away as we speak. So this leads to slow growth, also deformation of the spine, shoulders, hips, knees, feet, all of those areas, especially if it happens when you're young, like, that infant to like 4 years old, and that's when you get hit by it. Limbs are often though in pain because the sensation part isn't affected, just your being able to move them is affected. So then of course if they're not moving but they're experiencing the pain of not getting to move, you'll feel that sensation. Then we have Lissa virus. This is the one that causes rabies. This is another cool one that it's rare enough where it's cool if you get to see a case of this occurring. For this one, it's unfortunate because the patient that gets it, if you get to see a case, will die from this, like 100% likely to die from this. So it's a family of rhabdoviruses. That's the overall group of them. They're RNA viruses, and there's about 60 different viruses that make up this family. There's only Lissa virus and one other one that can affect humans, and this is the one out of those two that actually will kill you. The viral structure is kind of unique, so if you look at it using an electron microscope, you can definitely identify that, oh, that has rabies, because you see this bullet-like shape. That's the first thing that comes to mind is, hey, that's a bullet. And if you actually broke down the structure, then it's a helical capsid, and then you have the nucleic acid in there. It's an RNA virus. It has glycoprotein spikes that stick out, and then it does have a matrix like that. So rabies, the disease caused by Lissa virus, it's a fatal zoonotic disease. This is another one that you're not likely to spread from one person to another, but you can get it from a rabid animal. So when you're exposed to this, depending on how you're exposed and where you're exposed and how much you're exposed affects how quickly you end up dying from this. Has worldwide distribution, so anywhere in the US you could totally get it, and anywhere in any other country you could get it, except there's a few dozen countries where they went on the pretext, hey, I'm gonna never have any more cases of it, and they pretty much wiped out all the animals in the whole country. So there are some of these small countries out in Europe where they wiped out all wild animals of every kind to prevent any of this. So the reservoir is going to be wild animals, especially things like canines, wolves and coyotes as wild animals, skunks, raccoons, cats, and bats. All of these tend to be cases or causes, sources. And of course, all of these can also then pass it on to your domestic cats and dogs and other animals also. Which animal gives it to you tends to depend on where you're actually at in the country. Especially it's high in skunks and bats, although you can of course get it in any of these other animals. Infection is spread to your pets in some cases, or directly to you from the wild animal. The spread to human is going to be by either bites directly of the animal, scratches, or droplet inhalation if you're really close. Like say your cat or dog has been infected by a wild animal because you let your cat out at night and it went and got infected by some other wild animal, then it comes back in, and then you're cuddling with your cat if it actually likes to cuddle, and then you're close up so the droplets can't come directly into you. Same with the dog for that matter. There's about 55,000 human cases worldwide every year. Luckily, there's only a few annually in the US, but all those few do die from this. And of course, that means about 55,000 people die across the world every year from this. There's about 6,000 cases in wild animals in the US annually.
But the wild animals don't die from it, right?
Oh, they totally die from it too.
Oh, they can't live with it?
No.
Even though they pass it on?
Yeah, but they'll have it for a while in them, and then they'll start showing similar symptoms actually to what humans show, and that's when they'll get aggressive and want to bite you and lose their fear of you and all that, and that's how you're more likely to then be infected. So this is kind of the animals that would tend to have it. So like in the Central Valley, you were most likely to be exposed to a skunk that has rabies, and that's how we would have it. And you can see the skunks big on northern US, on the east coast all the way down to Florida is most likely raccoons. Couple parts in the south area, foxes are involved. But that doesn't mean you can't, if you come across say a raccoon in California, it doesn't mean you can't get it from a raccoon here, but it's just more likely to be a skunk. So the virus is in saliva, and then it's going to enter a wound or enter orally or nasally, like if you're exposed to a dog or a cat that's coughing or sneezing on you. Or you get bitten or scratched, and that's how the saliva gets in that way. So it's going to multiply at that initial site of infection, and it multiplies there for about a week. Then from that area, it's going to enter your nerve endings, just like HSV, varicella zoster, all of those did the same thing, and then they went latent in your nerve. In this case, though, it never goes latent, but it's going to use those nerves to migrate throughout the body. So in this case, it's going to migrate from your peripheral nerves, wherever you got the bite or scratch, or you breathe in, and then the peripheral nerves around your nose. But it goes to the ganglia, makes it to the spinal cord, and from there into the brain. Multiplication in the brain, once it gets there, is followed by spread from there throughout the rest of the body. So eyes, heart, skin, and oral cavity. And if you have a person that lets it progress or progresses that far also, like they will have the virus in their saliva. Technically, if a person with rabies that has progressed that much bites you, then they could spread it to you also that way. But just the chances are pretty slim, because often a human will actually die from it before it gets to that point. And also they're usually diagnosed, so they're tied down and kind of like kept from biting people. Replication in the salivary glands then allows release into the saliva, and then that's how it spreads to the next host, whatever that host may be, as that person, animal, whatever it is, bites the next host or potential host. So this virus moves very slowly along peripheral nerves, which also makes it harder to diagnose. So if you get, say, scratched or bitten or something by a wild animal on your foot, it's going to take like 2 months between when you get scratched or bitten and when you actually start having symptoms. So you've been like, oh, I got scratched by that, skunk or wild feral cat or something, and oh, I didn't even think about it. And then 2 months later, you start experiencing symptoms. By then, it's actually too late. If you get to the point of having symptoms, you're going to die from this, which is the downside. But it just moves really slow along your nerves. And it's going to depend on the site. So the closer it is to the central nervous system, the sooner you'll experience symptoms. So if a cat or something happens to bite you or scratch you on a neck or arm or something, it's closer to your brain and spinal cord, you'll experience symptoms sooner than if it bit your foot. And of course the dose of exposure, like if it actually bites you, there's going to be more saliva going into the wound than if it just scratched you. Prodromal symptoms, those early ones: fever, nausea, vomiting, headache, and fatigue. And you can also experience pain at a bite site. Then you start developing the specific symptom. And they say actually, like if you get bitten or scratched and you know that the animal may have been ravaged, like the first thing to do is like wash it nonstop with soap and water, and that decreases the chances by like 80 to 90% of actually getting infected at that point. So any wild animal or weird domestic animal that's acting weird does anything like that, that's the first thing to do is just like nonstop wash it with soap and water. Then you usually still want to get rabies shots, because by the time usually they'll, I got bit by some animal and ran away. It'll take animal control a while to actually identify what animal it was, capture it if they can. Then they do a biopsy on the animal to identify that it had rabies or not, and then by that time it could have migrated in you. So you need to actually get a series of shots like immediately after being exposed to actually not end up dying from it. Because by the time you get to symptoms, you're going to die from it. Specific symptoms after you get through this prodromal period, you have the furious phase. That's where you'll experience neurological symptoms. One of the examples. So agitation, disorientation, seizures, twitching, things that signal a neurological issue. And that's agitation is how it got its name. So furious phase, you have especially seizures of the neck and throat muscles also during that time, and that makes it very painful to swallow anything like food or water. And because of that, the patient will actually develop hydrophobia, or a fear of water. Like just seeing water, they'll freak out. It's like, oh crap, if that goes down my throat, I'm gonna be in all kinds of pain. So it's a fear of any liquid, not just water, but that's the poster child of fear of liquids. Patient is still coherent and alert at this point, so it's not like they've gone completely crazy, but if they see water, they're like, holy crap, I can't even get away from that. They can also go through the dumb phase, and the patient can like alternate between furious and dumb, but they can also have the dumb phase, and that's when they'll go through from being hyperactive to being paralyzed, kind of in that. Being the equivalent of being in a coma, but still having your eyes open. So you have disorientation, and you'll be stuporous, have a lack of response, like someone clicks their fingers in front of your eyes and you don't have any response to it. Either phase can result in developing coma and death, and you don't have to go from one phase to the other. Like you could just go straight into the dumb phase and die, or just into the furious phase and die. Death is usually going to be a result of either cardiac failure or respiratory arrest. One or the other is the one that finally kills you. There's been a few cases of this, weird ways, like, I was in a church and a bat came and sat on me and I didn't think anything of it, and then a couple of months later they end up dying of rabies. The case, I think, earlier this semester, I think it was sometime last year, that someone in Wyoming got bitten by a bat or something. Like they woke up with a bat and then landing on them in their bedroom or something, and they just like, oh well, I got a bat in the house, and yeah, they apparently didn't think anything of it, and actually they said, hey, I got bit by a bat, and just to let you know there was a bat in my house, but refused to actually get the shots because they're like, hey, I'm tough, I'm not worried about any rabies. And yeah, a couple of months later they ended up dying of rabies. Diagnosis. So symptoms after a definite bite or scratch by an animal. So, obviously if you go trying to threaten a mother black bear that has cubs, yeah, it should attack you and bite you and beat you up, because you shouldn't be doing that. But unprovoked, like you're just minding your own business and not threatening anything, and then something just comes out of nowhere and starts tearing you apart, that might be a sign that, hey, I have rabies. Delayed symptoms can slow diagnosis, because of course, it's a very slow replicating virus, but other symptoms are going to be non-specific. The same symptoms you would have, say, with psychosis, like agitation or depression, can also, you're just agitated at someone at work or depressed about a failed micro exam. That shouldn't be like, oh crap, I got rabies. But if you couple that with, oh, I got bit or scratched by this wild animal, then you may want to think about that. Other encephalopathies, like some viruses, cause the same kind of symptoms of delirium and being confusion, and then muscle spasm, something like tetanus, which are the exact same thing. But animal testing is a big one, and that's how they diagnose those 6,000 animals a year that have it. Is that some animal comes out of nowhere and starts attacking your pets or you or something like that, or things that normally are wandering at night start wandering in the day, like a skunk you just see walking down the street in the middle of the day when it should normally be a nocturnal animal. That might be a sign that, hey, something's wrong with that skunk. Treatment. So now at least it's easier than what it used to be. Now it's intramuscular shots, and you have to get them in 4 doses, day 1, day 3, day 7, and day 14 post-exposure. And the idea is to rev up your immune system big time so that eventually it gets to the virus before it makes it to your central nervous system. And if you waited, say, a month to get this vaccine, it's too late. It's actually spread, and then you're not going to get rid of it. It used to be a series of like 13 or 14 shots that you had to get every day, and it was into your stomach. Yeah, that was supposedly very painful. So this has progressed a little bit since then. Have that going for us.